So I'd like to thank Thrombosis UK for the opportunity to present a short summary of the Chaps trial. Chaps is a randomised control trial funded by the National Institute of Health Research Health Technology Assessment Programme. It's a study sponsored by Imperial College London and endorsed by Thrombosis UK, and it gained national research ethics approval to run in hospitals across the UK. So to provide you with a brief bit of background to the trial, deep vein thrombosis occurs in approximately 1 to 2 per 1,000 adults in the UK, and just under half of those affected will go on to develop lifelong disability from post-thrombotic syndrome, known as PTS. PTS is defined as chronic venous symptoms or signs secondary to DVT, and this may include lifelong leg pain, edema and skin changes, progressing in about 5% of patients to venous ulceration. Venous ulcers are painful, they often recur, and they can be expensive and difficult to treat. So clinical guidelines from NICE recommend that all patients who have had a DVT should receive anticoagulation as per standard of care, and this is usually for a minimum of about 3 months. And until 2015, it was also recommended that patients wear a graduated compression stocking to reduce their risk of developing PTS. But do compression stockings actually work? There's been much debate in the literature as to the value of stockings in preventing PTS. Trial results have been inconsistent due to poor adherence with stockings, making firm conclusions as to their effectiveness difficult to ascertain. Systematic reviews of the literature highlight the need for a large definitive trial to settle the discrepancies between earlier positive trial results and the later negative SOX trial. There's also inconsistency worldwide. In the UK and USA, stockings are not recommended, however in Europe they are. So the main aim of the Chaps trial is to measure the difference in the incidence of PTS at a median of 18 months follow-up after first acute DVT between standard clinical care, which is anticoagulation only, and the intervention arm, which is the addition of the graduated compression stocking. Chaps is a multi-centre, pragmatic, blinded outcome assessment randomised controlled trial. And the trial will follow up patients for a median of 18 months and will run in around 11 secondary care hospital trusts in the UK. So the criteria for joining the study include symptomatic presentation of first deep vein thrombosis less than 2 weeks from diagnosis, and this needs to be imaging confirmed lower limb DVT. Patients need to be able to give informed consent and be aged 18 or over. Patients will not be eligible to join the trial if they have any of the following exclusion criteria: a life expectancy of less than 2 years, any contraindication to wearing stockings, or previously intolerant of or already wearing stockings for more than a month. An ABPI or less than 0.8 or pedal pulses absent is an exclusion criteria, as well as bilateral deep vein thrombosis. Previous chronic venous insufficiency, defined as C4, 5 or 6 by the SEEP classification, any pre-existing post-thrombotic syndrome, or any newly diagnosed cancer, metastatic cancer, or cancer undergoing active treatment or palliation is also an exclusion, as well as a contraindication to anticoagulation and any known allergy to fabric in the compression stockings. So this slide just summarises the flow of patients throughout the study. Patients will be assessed for eligibility, they'll be consented and then randomised 1-to-1 between standard care and the intervention. All patients will be followed up at 6, 12 and 18 months, with some patients followed up until 30 months, depending on when they entered the trial. In addition to this, around 200 patients will be invited to take part in a parallel process evaluation where their use of stockings will be explored with a qualitative researcher at University College London. The primary outcome measure for the trial is any incidence of PTS using the validated Villalta criteria over the median 18 months follow-up. Chaps will measure a series of secondary outcomes, including any changes in quality of life, which includes the EQ5D and the Vanes Qual scale, any change in employment status, will measure the adherence to stockings and anticoagulants, and will perform a cost-effectiveness analysis with an appropriate sensitivity analysis. So at this stage, we need you. Chaps has been paused to recruitment since the start of the COVID-19 pandemic, but we're now slowly reopening and looking for new secondary care sites to run the study. We're looking for a sample size of 864 participants with a first acute DVT to take part in the study. If you're interested in acting as a principal investigator or you think your hospital could run the study, please do get in touch by emailing us on the Chaps trial email address or messaging us directly on Twitter. We'll then be able to link up with your R&D office and discuss feasibility. This is an important study and we need your help to make it a success.